Improving the overall experience at healthcare institutions across the country is the main objective of the two-day workshop underway at the St. Joseph's Parish Center here in New Providence.
The pilot workshop by the Ministry of Health and the Public Hospitals Authority seeks to improve the overall efficiency of healthcare throughout the country, primarily in advance of the National Health Insurance Scheme. Carla Palmer reports.
Dr. Calais Philippe is among leading physicians and nurses committed to fixing whatever is broken within the healthcare system.
We've identified that there is an increase in readmissions of patients. There's also a high rate of patient dissatisfaction with the current healthcare system.
This group, of which Dr. Philippe is the chair, is focusing specifically on improving the discharge planning process at public healthcare facilities. Following a reported baseline study at each institution, Dr. Philippe disclosed the results.
The main complaints in terms of discharge process was for the physicians that the form was too long. For the patients, they wanted more information in regards to their disease and their management, their self-care management.
Going into the workshop, Dr. Philippe and her team have already formalized a strategy. The answer, they feel, is implementing an integrated healthcare system emphasizing teamwork, where the right information is disseminated to the right people at the right time.
Recommendations going forward is to implement a discharge planning portfolio of forms until we get to our integrated IT system, so that once a patient moves into hospital, they're at the clinic, they're at a private or public clinic, we can track the progress of their health care throughout the system.
Chief Medical Officer at the Ministry of Health, Dr. Glenn Benaby, says quality care for residents nationwide is not only the ultimate objective, but is essential. He says a state-of-the-art healthcare facility is nothing if it lacks human resources.
But the center doesn't matter too much if it lacks the human resources and patient care. And so we come together now to put meat on the bones, to put flesh on the bones, to improve our healthcare system throughout the archipelago of islands, and to ensure that the healthcare system is patient-centered and community-based, and it's in keeping with the model that is being put forward by our strategist partners, the medical home concept.
Healthcare professionals say they are committed to not only bring a greater appreciation of the medical role, but improved service to the communities they serve. Carla Palmer, ZNS Network News.